So first of all, would you mind just introducing us to yourself and tell us a little bit about how Jo Divine and how things came to be as they are now for you?
Okay, so I'm Sam Evans, and my husband and I set up Jo Divine in 2007. He comes from an IT background. I'm a former nurse. Mad idea, set up a sex toy company, but we decided to set up one with a view to only sell skin safe products and irritant-free sexual lubricants, and we've stuck to that. That's the ethics of our company and our brand. And so, you know, we only sell sex toys that are made from skin safe silicone, glass, metal, ABS, plastic. We only sell 3 sexual lubricant brands, but, you know, they basically, Yes and Sutil Luxe are predominantly the ones that we sell. We sell 1 silicone lube, and they do not contain irritating ingredients, which I'll talk about briefly. And that's why that's really, really important. It's my passion. And I'll explain why that's my passion too. So, and basically, so Jo Divine was set up, skin safe sex toys, but then I realized that people were phoning us up to buy sex toys for certain health issues. So I thought, well, what can I do? What can I contribute to the company? So then I started writing hundreds and hundreds of articles, practical sexual health and pleasure articles, to help people, regain their sexual function and reclaim their sex life. And actually cancer was the thing that came up predominantly. Breast cancer, gynae cancers, prostate cancer. Those are the 3 things, bowel cancer as well. But I mean, any cancer that impacts upon your sexual intimacy and pleasure. So there's loads of practical articles on the website. We have done videos for YouTube. They have been removed at the moment because YouTube is sort of blocking stuff. You can go in and sign in, but we're going to move those to another platform. I do videos on my little Instagram account, which is at Sam Talk Sex, so sort of little practical videos. And actually, as a result of setting up the company and realizing that people were buying sex toys to help people with sexual health issues, in addition, obviously buying them for pleasure, because ultimately we're a sex toy company, the health side of it sort of came out of that, really. It was like, so with our local hospital at Tunbridge Wells, we created a little health brochure here, and it's got sort of slim sex toys in it. It's really hard to show, and it's got dilators and the lubricants and clitoral stimulators and pelvic floor exercises. It's due for an update because we've got some lovely new products to go in there. And so basically that was in Tunbridge Wells Hospital with the physio there, with the urogynecologist and the gynae ward manager. And then that now gets given out across the country in various places, including breast cancer clinics. But actually, for me, it was normal, for Paul and I, it's to actually normalise the conversation around sex, to normalise the conversation about using a lube and using sex toys, because, sex is meant to be, noisy, messy, embarrassing, consensual, pleasurable, and most of all fun. And I think often, when you've got a health issue, you've been through cancer treatments, and actually that is taken away from you sometimes, and it's very difficult to reclaim, your sex life, which was probably good before you had the cancer, and why shouldn't it be good afterwards? And so that's basically what Jo Divine is. But my passion about intimate health stems from my own sexual health as well. So in my 20s and 30s, when I met Paul, obviously we're having sex, and we were using well-known sexual lubricants, and I kept getting recurrent infections, so thrush, bacterial vaginosis, the fishy smelling discharge, cystitis, urinary tract infections. It was monthly this was happening. It was a cycle. It would often be after sex. And that actually led to me developing vaginismus, so the pelvic floor muscles tightened up involuntary. That made penetration feel uncomfortable and painful, or not possible sometimes, because I'd be thinking, am I going to be up all night sitting on the liver cystitis? Am I going to be itching tomorrow and work on the ward with thrush? Nobody at any point during my journey actually asked me about my sex life. What was I even washing with? What washing powder was I using? Nothing about lubes. And I literally, the advice I got given was iron the gusset of your knickers to kill the thrush bugs.
Wow.
So it was actually, and I only overcame it when I actually got a diagnosis of vaginismus at 30, but it wasn't until we set up Jo Divine and started selling organic lubricants and using them ourselves. Within probably about a week, I remember saying to Paul, not had any irritation or itching or stinging, or had cystitis or urethral irritation. And as I started to look at that and realised it was the ingredients in all these well-known lubes that were causing the irritation. So that's my passion. And then that's led into the whole intimate hygiene industry of the things that people are washing themselves with, bath bombs that I call thrush bombs. And the whole industry, and people don't understand that they've really got to look after their intimate health. And certainly when they've been through cancer treatments, and certainly when they're going into perimenopause or menopause as well, because these vaginal changes happen. So that's my passion, which is why hence I talk about vaginas and lube so much. I'm known as a lube queen, so that's
but you know, just listening to you, I think it's really refreshing, because don't you often find that subjects like menopause and sex aren't talked about? Take away the cancer stuff, even without all that. But just people generally don't seem to want to talk about that, as if it's like a bit of a taboo subject, and it shouldn't really be, should it? But I suppose when you add in the cancer diagnosis, it becomes more of a, I'm ashamed to say, you know, that I'm feeling these things or whatever. So what's your take on that, as in it's just really not talked about much?
I think it's the one thing of, certainly, you know, as a menopausal woman and part of the whole Make Menopause Matter campaign, I'm probably one of the few people who's been very frank about menopause and sex, because I'm a menopausal woman and I've found out what works for me, and I want other people to know about it. And because it's not rocket science, you know, using a good lubricant can transform your intimate health and your sexual pleasure. And it's that whole thing. What's the problem with sex and menopause? It always boils down to vaginal dryness. My quiet voice, my Miranda voice. And you know, and it's actually, I'm always amazed at women when they say, oh, what is this vaginal dryness? Because they've never experienced it before, and they're like, lucky them, you know, and they've never used a lubricant. And you know, it's because it's about, you know, sex, and it's about our genitals, it's about our vaginas, our vulvas. People don't even use the right words. You know, and actually, so it's brushed over in so many menopause books that I've sort of read and seen, and it is changing because I've contributed to quite a few recently. Sex is just brushed over. Oh, well, you might want to use a bit of lube, and I've seen that on websites as well. And it's sorry, you know, and then the thing for me is, well, people will say, oh, well, you know, we're talking about sex because it's so empowering. Well, actually, no, it's not. This should be part and parcel of what you're talking about, because the sexual implications and effects and symptoms of menopause can be huge. They can destroy relationships, they can destroy your sex life. You know, we hear about people, you know, and it's the same with cancer, partners who drift apart, when actually if they'd been given that bit of practical advice, it could have made a big difference. And I found that quite sad. But for me, you know, people think it's really funny, they giggle, and then they don't get to talk to me, because you can hear how I speak. I talk in a professional manner, but it's fun. And, you know, sex is pleasurable, and it should be. And, you know, using lubes and using sex toys, you know, talking about it in a professional manner takes away that embarrassment. Don't get me wrong, I do talk to people and they get really embarrassed. I talk to healthcare professionals, and it's so funny to sort of slap a toy in a consultant's hand at a medical conference and, oh, what do I do?
All of a sudden they're like, I don't know what to do with
that. All day, you know, this attitude, I mean, also it's the subjective views of healthcare professionals too, as to whether or not they are imparting that information, whether they feel comfortable as well. And the other thing for me is actually giving people the advice about the good products too. And then when you talk about cancer, you've got the added guilt of asking somebody, you know, because you've cured my cancer, or you know, you're treating my cancer now. Should I be interested in sex, or should I just be grateful? And my God, I am so fed up of hearing that. You know, no one should ever have to feel grateful for being treated or having effective treatment or managing their cancer and wanting to still have a sex life. This is really, really important. Sex, so many people, you know, and having sex in whatever way they want to or are able to. So that's my take on it.
I think, no, and you're absolutely right. It's a massive part of your life, and I think that when you have a cancer diagnosis, like in particular for me, who has secondary breast cancer as well, it's, you suddenly have a rung of things that become, you know, what should be important, and it's obviously the treatment, and it's, you know, what works, but then other things go further and further down the list, and then all of a sudden some things just don't get talked about. I mean, for me, I went through the menopause because of my treatment. I basically have no estrogen. So I had all these things, but it all hit me at once as kind of like a medical menopause, if you like. But nobody talked about it, and nobody explained some of the things that were happening to me, and some of the things you obviously hear about, mood swings, and you hear about, you know, low sex drive, all those kind of things. They all go part and parcel, but then no one really helps you through how to diagnose it like they would if it was part of your cancer treatment. Someone will explain that to you, and someone will give you a leaflet or a booklet, or But I tend to think that in those kind of circumstances, that part just doesn't really get talked about. And then you're left wondering if the way you're feeling is natural.
Yeah,
Or
actually, and it's actually menopause.
exactly. But until someone starts to explain those symptoms and side effects, and also how to get round them, and sort of tips and tricks to help you sort of find your way through it, I feel like, certainly for me as a patient, that's been quite a massive thing over the last couple of years, is you're finding a lot of things out yourself, and sometimes you're not even sure if you're looking in the right places for information. So I guess part of this is about opening up that conversation and saying, what questions do people have? And, you know, and a lot of the things you've already talked about is some of the questions that, you know, came up for me when I asked what people wanted to know about, which was, you know, low sex drive is a massive thing. Other things that were coming up were, what are the best lubricants to use? Because they do feel their sex life with their partners, you know, or their husbands or wives, is suffering. And it's about how they feel like they're wanting ways to reignite it, if you like, or even just to address it in a natural way that makes sense to them. So what's your thoughts, first of all? I know that's quite a lot of stuff I've just mentioned there, but lubricants, if we maybe start there, is there things that you can suggest for a cancer patient or someone who's going through treatment that can help them?
The first thing I do talk about is having an intimate regime. So if you're able to have local estrogen, as you said, that you're somebody who can't, but these are mine, these are the pessaries with the little applicator, and I'm sure. But a lot of people are told they can't have it when they can actually have it.
Right, okay.
I mean, I know Dr. Liz O'Riordan, she's a breast cancer surgeon who's had breast cancer. She's done loads of videos about this. And so that's something really important to discuss either with your oncologist or your GP or your breast cancer nurse. But, if you can't, and obviously a lot of people can't, I always say to people, it's really important that you use a vaginal moisturizer. I'm not talking about lubes. This is a moisturizer. So there's vaginal moisturizer, which is an organic vaginal moisturizer. And also we have Sutil, which is a water-based lubricant that doubles up as a vaginal moisturizer. Now, for me personally, I use local estrogen. I'm menopause, but I don't have breast cancer. I use the local estrogen 3 times a week, and I use the vaginal moisturizer. It can come in a little applicator like this. Pop that up inside my vagina twice a week, but you can also use a lube tube, so it's like a little syringe, and you can fill that up. It's about 5 mils. And you can also pop it up inside your vagina, and then also you can massage the whole vulval area. That basically maintains the health of your vulval tissues and your vaginal tissues, because they need to be flexible. And what happens when you hit menopause, the depleting estrogen basically causes the tissues to tighten. That can cause vaginal tightness, it causes stinging, it causes irritation, itching, thrush. The tissues can break down often around the entrance of the vagina. That goes very thin and it become quite sore. That makes penetration feel quite uncomfortable too. So, really important to use a good vaginal moisturizer, even if you can't. They're non-hormonal, so they're, obviously absolutely fine to use.
Safe.
And then a good vaginal moisturizer. So again, have, a water-based formulation. Water-based lubes are closest to your own body's natural lubrications. Vast majority aren't particularly long-lasting. Having said that, Sutil is water-based. It is really long-lasting. I'll explain how that works. You've got water-based, great to use, for any form of sex play. It's got no taste, so it's fine for oral sex. You can use it with sex toys, with condoms. It's completely compatible with all those things. And then they've got oil-based. So that's an oil-based lubricant, not compatible with condoms like any oil-based product, but you can use the two together, and it creates a double glide. Put the oil on first, so put that on your partner if you've got male partner, and then you put the water-based on. It just makes it longer lasting. The oil-based is great also for, if you're feeling a bit sore during the day, or if you're going swimming in chlorinated water or seawater, I often pop the oil-based on. Great as chapstick as well. It's great for your chapped lips and dry skin, and we used it as magic cream for our kids. So, it's actually...
it's got many uses.
And then, Sutil, which is a brand that we're pretty much the only company in the UK that sell it. Sutil Luxe and Sutil Rich. That one's a bit thicker. It's got a little bit of horny goat weed in it, which is actually a vasodilator, so opens up the blood vessels. It can cause a little bit of a sensation, so I tend to tell people use the Luxe, but it's, it can also be used as a vaginal moisturizer too. This one's a bit thicker, it's going to be used for anal sex too. Think about lubes. Ingredients, okay? Ingredients really matter. The vast majority of lubes out there on the high street, on the shelves, being recommended by healthcare professionals on prescription. They mainly contain irritating ingredients. So basically we're looking at glycerin. Glycerin is a sugar, and that can cause thrush. It creates a sugary environment for thrush to thrive. It also causes irritation. It's used in lubes because it's cheap. It also makes the lube feel quite sticky. Then propylene glycol, that's another well-known vaginal irritant, and that's actually used in antifreeze. So it's not a great one. It's the ingredient also that often can make a lube sting when you first put it on, and that puts couples off, and they think every lube feels the same. And it's not just somebody with a vulva and a vagina, people with a penis, you know, and for anal play, people find we're getting more and more men coming to us and buying Sutil because they're experiencing stinging with the lubes. So glycerin, propylene glycol, parabens, they are preservatives which are hormone disruptors, so we need to avoid those. You've got alcohol dries out the tissues, especially in the vulva and vagina. You've got dyes, because you all need a pink vulva. We've got perfume products, because you need to smell like roses or vanilla. And we've got glitter, because you all need a glittery vulva, don't you? So, you know, I always say to people, be an ingredients detective, be aware. There are brands now saying, oh, we're parabens free, we're glycerin free, and then you have a look and they've got propylene glycol in them, or brands that have actually used other ingredient descriptions. And don't know what it is, Google it. I came across sorbitol, you know, again, that's something that's being used. It is a sugar alcohol. There is a potential there for it to cause thrush. Do a skin test, do it on the labia, on the lips of on one of the lips of the vulva, and actually, you know, just see how you get on. Don't just slap it on. But going back to Sutil, as I said, it's a water-based lube, but it interacts with your own body's natural lubrication, so it makes you feel wetter, and we know wetter is better. But also, I've never actually used a lubricant like it. It feels really natural, because a lube shouldn't feel intrusive, and I think that's a problem when people, they don't know how to use them. When do I put it on? You know, for me, popping a little bit of Sutil on before we do any play gets me going. Some people like to pop it on after they've done their foreplay, if that's what they're doing. They like to pop it on their toy. They like their partner to pop it on. They'll put it on themselves. They might only pop it on when they're ready for penetration. You know, for me, there's no point in sort of spending, you know, ages on foreplay and somebody being rubbed. It's just going to make the tissues feel sore. You know, use a good lube, and actually that feels pleasurable, and then that promotes your arousal and boosts your libido too, because it feels pleasurable, and you're feeling more lubricated and it feels nice. You know, then actually that helps people, you know, sort of get aroused too. So, you know, there's loads of information on the website. I never shut up about ingredients. So, you know, be an ingredients detective, but I can tell you the vast majority of products available on the high street do contain irritating ingredients and stuff on prescription. And talking briefly about lubes, I've talked about intimate hygiene products, you know, the washes, douches, you should never be douching, shouldn't be washing with anything really, just wash with water. If you feel like you need to wash, get a gentle emollient from your GP. No bath bombs, please, brush bombs, you know, but you don't need, and be careful of, you know, perfume menstrual pads, they just cause irritation. Perfume condoms, why? You know, so you just have to be really careful about what you're using, but just find what works for you. You know, there might be something out there that wouldn't work for me but works for you. But you know, why would you not use, as I consider them, the Rolls Royce of the lubricants compared to the Reliant Robin ones, you know? And it's not a matter of cost, because these are, you know, maybe a little bit more expensive than the things on the shelves, but a lot of the stuff on the shelves is quite expensive too. So, you know, and also spend a lot on your skin and your hair. Why would you not invest in your intimate health too?
That's a really good way to look at it. But also, just I think just to know that there is a safe place that you can go to buy these products. So knowing that if they go to your website, for example, all these products that are on there are safe for us to use. So it's one less thing, I guess, for us as cancer patients to worry about when you are constantly worried about, has it got something in it that will interact with your treatment or whatever. So that in itself is a really good encouraging first step, is just to know where to go for the products, I suppose.
Yeah, and just quickly say, you know, obviously if you're going for your cervical screening as well, you can take your own water-based lube. And if anybody tells you they're not using lube, then don't have the screening test, because you can use lubricant. It's just got to be water-based. You know? So I take my water-based with me, and I've never had a problem.
Never had a problem. So perfect. And so do you have anything that you could recommend for people who have like a low sex drive, for example, that comes from obviously hormone treatment, for example, it tends to just disappear and sometimes doesn't come back. So have you got any tips or tricks that you can help us with for that type of thing?
I always recommend that people masturbate. I think
Mm-hmm.
this is really, really important, even though you don't feel like it. You often, when you've been through treatments or you're going through the menopause, you do disconnect from your body, and I did when I had vaginismus. And so I always sort of encourage people to masturbate, in the bath or the shower. If you've got yourself a nice lube, dollop of lube on your finger, and masturbate. But obviously toys as well, something simple. Even not if you're not in the mood, but if you just start playing with something like a simple bullet like that.
Yeah.
And I always say this when I give my talks to cancer patients. I always say, get yourself a simple bullet. I mean, this one looks like a lipstick. It's just so much fun. But obviously there's lots of little toys that are out there, and obviously the ones that can be used internally can be used externally on your clitoris. But that just starts stimulating that sort of sexual feeling. And hopefully firing off those sparks, for you to, that actually feels quite pleasurable, actually. That's quite nice. And even if you don't have an orgasm, but you're just still enjoying it, and I think, and for people to use them on their own, if they're in a relationship, and then introduce them into their relationship with their partner. I mean, obviously a lot of couples will just use toys, and that we've got toys for somebody with a penis too, so they can buy couples toys. Obviously if they're same sex couples, they can share their toys as well. A lot of the toys can be used on both the penis and a clitoris or a vagina. They are sort of, you can swap them around, so that's really good fun too. But the game changers, as I call it, I mean, I mentioned this on the Davina McCall program. It's it's a sonic wave toy. So basically you pop that over your clitoris and you leave it in place. It doesn't vibrate. It basically sort of gently teases and caresses the clitoral tissue, and what it's doing is it's stimulating the blood flow, it's stimulating the nerves, the sexual sensation. That blood flow into the tissues of the clitoris and the vagina actually boost arousal and boost your libido too. And I know a lot of people are using these toys sort of pre-sex play or as part of their sex play, because it gets them going. But also waterproof, bath or shower, go off and use it on your own. It's such an innovative sort of design, the air pulse or sonic wave. And these are things that I am recommending to people, that these are really good toys. But anything, this is a little pebble toy with a squidgy tip. I mean, this one's called a candy cane. This can be used on your clitoris, nipples, on a penis. There are so many toys that they're not inexpensive, that you can start using on yourself to start feeling those sexual sensations, and actually remembering how it felt, because that's the thing for me. When sex was good, if it's good before treatment, why can't it be good afterwards? And actually for people to start remembering, and actually remember that they're a sexual being, that actually, I really, really like that. I did really enjoy masturbating. Yes, I like having orgasms. It's taking me a little bit longer to have an orgasm, but when I use my toy, that actually can really, really help. But also to use it with a partner, because also, painful sex is a big problem, as well as I explained about the vaginal tightness. So penetrative sex isn't possible, then obviously you can use his and her toys, and or her and her toys. It's whatever you're doing, it is actually to help those people. But the low libido, very much so, it's actually having that courage to say, okay, I might go and get myself a simple little bullet. I'm going to go off in the bathroom and enjoy myself, and then actually when I'm confident, I can bring this out and say to my partner, is it okay, we can use it? It's non-threatening as well. It's not like you're whipping out a 6-inch dildo. People always worry that their partner won't want them to use it, but I think partners are more than happy, whatever the sex is, anything that makes sex feel pleasurable. And also I think it's sort of, I'd say to couples, go to the website or get a catalogue, because we have also a normal catalogue too, as well as a health brochure, and have a flick through on, and it gets this conversation going. It opens up that conversation, and also then you can say to your partner, well, actually, I've noticed I've got sensation there, that feels like, I don't really want you to touch me there, or actually, I'm using this now because there's a little bit of decreased sexual sensation, but if you use it on me like this is how I've been using it. Or can I use it on you? Let's face it, people with a penis are going to actually love having a toy played on the head of the penis, because they will have never experienced that. Or having nipple play, It's those sort of things. It's actually thinking about being creative, and actually those erogenous zones that you didn't even exist behind your ear, behind your knee. It's all sorts of erogenous zones are everywhere, and it's actually firing those up. And I think obviously for people to be more creative with their sex life, and often find that people sort of say, actually we've had to be, but actually it's been really good fun because we've done things that we've never done before. We've bought toys, we've discussed stuff, we've tried things that didn't work, but we tried that, we like that, and I think it gets you out of your sort of perhaps comfort zone of sort of sex play, and it makes you think a bit more creatively. And then let's face it, the vast majority of people have never used a really good lubricant, which we know can transform your intimate health and your sexual pleasure. So that's a good starting point.
I mean, I think, as you've said there, a lot of it must be about just the trust that you have in your partner to be able to talk about these things, because sometimes as a cancer patient, if you've gone through a surgery, or say you've gone through a mastectomy, or and you've lost sensation in certain places that hasn't ever returned, for example, is it just about trusting and having that conversation and sort of knowing that once that difficult part is over, we're starting the conversation that then will help lead to the next parts that have to happen?
I think I remember doing one talk, and I remember this woman said, well, I never even thought of saying that to my husband. But then she did, and she actually messaged, she sent me, and God, we actually ended up having this conversation. He's really frightened. And I think that's the other thing as well. We know that, often partners are really worried about hurting you. And certainly when it comes to penetrative sex. And I think we don't think about the partner enough sometimes. It's we're always, which is we're focusing on the person who's gone through the cancer, or living with it, but actually talking to the partner, and that open conversation is really important. I mean, the other thing is, you've got couples who maybe for whom they were swinging from the chandeliers before they got their cancer diagnosis. So for them, sex has always been a bit closed in, and that's quite a difficult one. Obviously, I've always liked sex. My body hasn't always liked it, so I'm comfortable talking about it. But I do talk to people, for them, even phoning us up is a massive step. And then I start talking, and then it's like, and I have people phoning up crying, but by the end of it, we're giggling, and which is good. But I totally understand where they're coming from, because it's like, I've never spoken to him. You're using words like clitoris and vagina and masturbation and lubricant, and and actually for those people it's quite difficult. They've had sex, but it's not always been great. So but they still want to carry on having sex, but they've never, and you're always going to have people for whom they don't ever want to use a vibrator to help open up the vagina. And obviously a lot of people like using the dilators that we have, obviously, to help open up the vagina, because it feels a little bit more clinical, even though they're nice and pink and they're not clinical like the medical ones. But they're never going to buy a vibrator. But even if they actually invested in a nice tube of lube, that would make a difference, or a vaginal moisturizer. So that's sort of another thing that I do think about. I can go all guns blazing telling people, buy this and buy that and do this sex act and whatever. But it's, there are going to be people going, well, I really don't know. And obviously there will be partners who don't want to do this. Some men find it quite difficult using lube, because their view is, well, if I touch you, you should be wet. We've still got this whole myth of that, as soon as you're touched, that you're lubricating. We know that, your lubrication's impacted upon by so many different things. And for them to get over it, and also getting used to using a lube. I know my husband Paul, when we first started using, it's sort of getting used to using a lube, but we don't have sex without it now, because, well, for me personally, it's not possible. It's not going to be pleasurable, and if he knows it's not going to be pleasurable, it's not going to be pleasurable for him. So again, it's trying those things, which is why I always say to people, take yourself off and use the lube on your own to see how it feels. Use a sex toy on your own, and then when you're confident, say to your partner, actually, I bought this, would it be all right if we played with it? And actually, I'd quite like to play with it on you. And and then it can open up that conversation. And also, don't forget the kissing and the cuddling, because I just think that often we switch off in menopause, particularly. I can't have penetrative sex, so I can't have the sex that I want, therefore I'm not even going to kiss and cuddle you. That's so important, the touching and the kissing and the cuddling and the talking to each other, maintaining that intimacy. But I think when you understand your own body, you can then guide your partner to where it feels nice. As you say, if there's no sensation, you don't want them to touch it, or it feels a bit weird, then you can say, actually, do you mind not touching there? But actually, I quite like being touched here. Or, well, that's really nice when you're stroking it. Well, I like that sensation that you're doing. And, I think you've got to give feedback to a partner too, to let them know. And often a partner will say to you, does this feel okay? And they need reassurance.
Yeah, so absolutely. So a cancer diagnosis often will bring on the symptoms of menopause. So I know you were involved in the Davina McCall programme, Sex, Myths and Menopause. How do you think the response to that? Do you think that's helping the conversation? Do you think there's more people talking about things like that now? Or
it's been amazing. Can I just say that? I have never had so many conversations with people, and also from a cancer point of view as well. I'm being asked to do so many talks now, and I've got healthcare professionals who are talking about, I'm working with some therapeutic radiographers at the moment. I just did a podcast with one, he's just brilliant. And, to have therapeutic radiographers talking about this, so many more people now want to talk about sex and cancer and the menopause. And but it's actually opens up the conversation, and also, the messages that I get, because people, I suppose I live in a bit of a menopause cancer bubble, and I'm assuming that people know this stuff and they don't. I'm assuming that healthcare professionals know this stuff and they don't. They don't know what to recommend. They don't even know how to open up the conversation. So having a little health brochure is such a great opener. And some keep some of our products in clinic, and they say you can give Sam a call or have a look at the website if it's not blocked on an NHS server. But it's the response, and also for people going to their GP and people who have breast cancer and saying, well, actually, I can actually have local estrogen, so please, can I have it? I've done my research, I've gone to the websites where they've got the clinical evidence-based information, and it has made such a difference. But we've still got such a long way to go. And for me, personally, educating healthcare professionals, it starts with healthcare professionals. Talking about cancer, talking about sex has to be a compulsory part of cancer treatment, of any cancer treatment. But it still isn't. And also poor advice is still being given, poor sexual lubricants. People are being told to use things out of the kitchen and bathroom cupboards. Or it's just like, why are you worrying about your sex life? You've cured your cancer. Aren't you too old for that? Oh, you don't have a partner. To hear that for a young person at Trekstock, or the Daisy Network, they're the premature ovarian insufficiency charity that I work with, that's heartbreaking. It's like, well, when this girl just said, well, have you heard of solo sex? It's like, so the very, you've got it's a man and a woman, and they're not actually thinking outside the box, that people enjoy sex in so many different ways, that actually you need to start talking about it. But to be able to educate, healthcare professionals saying, God, I was recommending KY, I had no idea, but actually now we're going to start recommending this, and then getting samples in to give out to the patients. So it's just like, and for them, I think with menopause and cancer, is actually to make healthcare professionals feel confident, to open up the conversation, to know where to go with it, and say, actually, this website's got loads of information. Oh, I remember reading an article on there. Or, there might be a little video or something. But also for people to seek help, because now they've got this information, they've watched that program, and there will be another one this year focusing on the workplace. It'll be focusing on lifestyle, exercise, diet, people who can't use hormone replacement therapy, which is really good as well, because there are some people who can't. And I just think it's opened up that world to these people, that actually, well, I'm going to go in with all the information. Don't get me wrong, not everybody's being successful, but actually I do know HRT prescriptions have gone shot up. My own pharmacist actually said, I made some comment, and he said, oh yeah, and he said, oh, it's since that program. I said, yeah, I was on that program. But I was like, that's great. And my practice nurse said to me, oh my God, I haven't stopped giving out, prescribing local estrogen. She said, it's been brilliant. So because she said, I've been able to talk about it. So did you watch the program? And I think it's just giving people the confidence to say, or just educated them to make them aware those symptoms are menopausal, and you don't have to put up with them. There are some things that you can do. So it's been brilliant. I love, it's been fabulous. I'm so proud to have been part of it.
I completely agree. I think it's a massive thing. I think for us as a charity, obviously we're there to help patients with secondary breast cancer, and a lot of that is about educating the wider public about the signs and symptoms, and we know how big a job that is, and how even sometimes having to interact with GPs and nurses, and because there's so many different parts to it, so we know how big a job it is even just for that. So the education part of it is massive, and I think the more people that talk openly about menopause and sex and the side effects, whether it be through cancer or not, is massive. And I think once more people start to do that, it becomes a conversation that's a lot easier to have, as opposed to it being quite a taboo subject.
And also, as I keep saying, it's not rocket science.
Yeah.
A good sexual lubricant, good vaginal moisturizer, a simple sex toy, talk to your partner, go and have a play, have some fun, have orgasms, masturbate. It's like, but if people don't feel they can, I mean, it's funny, I've spoken to people who said, oh my God, my GP recommended you. I was amazed. And it was almost like it opened your eyes to a GP. Yeah, he's a human being too. And I hear that quite often. They go, no, and healthcare professionals say, oh God, it's given me I've had amazing conversations with my patients. And they go, my patients are different ages. I mean, our oldest customer we know of is 93. So,
Wow.
That's the thing. And sort of, I think it's, as you say, it's giving people that information for them to know. And I hate the word taboo. I don't, menopause is always considered taboo and sex is considered taboo, but it shouldn't be. As a former nurse, sex is one of your activities of daily living, but it was always a thing that we brushed over. I mean, male or female, never asked people anything about their sex, like even on the gynae wards. And I, realised, I worked in renal and realised that a lot of my patients, it was impacting upon their sexual function, but nobody was interested in finding out about it. And I'm also trained in occupational health, so I love, health promotion, preventative, but also educating people so they can actually stay well, and they can, it's a lot of self-care, isn't it? It's actually managing your own health. And I think that's the thing about with saying to somebody, giving this back to them and saying, well, have you thought about using this lubricant? Actually, you might want to buy that sex one. It then enables them to take control of their health, because often, obviously during cancer treatments, a lot of people feel like the health has been hijacked. And actually, it's been medicalized. And I've had so many people say, oh, I wish I'd been told about your vibrations instead of the horrible medical dilators, or I wish I'd been told about that lube, or and then it just gives that person, they've got the power to do something and actually make things better for themselves. And it's nothing to do with the healthcare professional or the NHS or medical care. It actually has been given back to them, and that control, I think that is, you've regained control back of your body, because you've actually been through this treatment, which has sort of hijacked your health, and well-being. So that's how I.
And so on the subject of sex toys, for example, you spoke earlier about sort of the different ranges of things you can get. Has that changed over time as well? Have you noticed that things are changing and expanding in terms of what's available to people who maybe are looking for different ways to open up that?
No, definitely. I mean, obviously the world has moved on since the rampant rabbit, which is like 20 years old, thank God. And materials have moved on. Don't get me wrong, there's still very, very poor materials out there. So jelly, latex and rubber, we don't sell any of those. They're highly porous. They absorb bacteria, they're difficult to clean, they degrade over time, they leach out chemicals. So you've got to be really careful. Be aware of, obviously, where you're buying your toys from. Always buy from a reputable sex toy retailer. Somebody like Joe Divine, where we've got an address, we've got a phone number, we've got an email address, we've got social media. You can contact us in so many ways. Be aware of websites that literally are pop-up websites, and there's nothing. There might be a mobile phone number, there's no contact details. Be aware of descriptions on sex toys, because often some people aren't particularly honest about what the materials are made from. But no, the world has changed because people are embracing enjoying so many different ways to enjoy sex, so many different types of sexual activity, so many different sexual orientations and genders, and so I think things are starting to have changed. I mean, and it's really important, but you've got to be really careful. I sort of talked about there's a lot of fake toys available online, which is really important that you're very careful about where you buy stuff from. Used toys, which is because there's a lot of samples out there and then they get repackaged. So that's why we've got all this information on the website, because we really care about your sexual health and pleasure. You know, we don't sell stuff that we wouldn't use ourselves, you know, that we use pretty much, we've tried pretty much everything. There's some stuff that I won't try, but you know, but other people have tried it for us. So you know, but yeah, no, it has, because, you know, as I talked about the sonic wave toys, these came to market a couple of years ago, and they've been transformative in helping people with their, you know, sexual pleasure. I mean, obviously with menopause and cancer as well, you get decreased sexual sensation. It doesn't feel the same anymore. You might be struggling to orgasm. Therefore, those toys are absolutely brilliant, you know. And we know that sex changes over time anyway, you know, and actually what worked for you once might not work for you now. It's about exploring new things. I mean, I personally discovered my G-spot several years ago. It's way back yonder with the toy, had no idea. And now I know where it is. I know how it can be stimulated during any sex play. So, you know, for me, I owned a sex toy company, but didn't think I had a G-spot. So it's about trying stuff as well, isn't it? And if you don't like it, you have a laugh. We didn't work out, you have a laugh when you move on. And if you do try it, you think, oh gosh, actually, I do like that. So it's, you know, that's why the website goes from cancer to kink. You know, again, that's another thing as well. You know, just because you've had a cancer diagnosis or gone through treatment or going through treatment doesn't mean to say you're no longer into kink and enjoying BDSM. You know, so it's actually not sort of, you know, ignoring stuff as well. And again, talking about the BDSM, you've just got to be careful with that, with impact play, you know, with the tissues, the skin. Hello, sorry, I think you froze.
Hello there, sorry, I think it froze there, sorry.
So I was just quickly saying about impact play, so that's sort of, you know, spanking or flogging, and also temperature play. So if you're using wax or you're using fire play, just be aware that obviously the skin can be quite sensitive. You might be hypersensitive, or you might actually have, you know, limited sensations. So you just have to be careful with those things, really. But again, it's actually saying, you know, whatever feels pleasurable for you.
Absolutely. And I think sometimes that's it. I think sometimes the seriousness of a cancer diagnosis kind of takes over absolutely everything, and therefore you forget some of the basics, and you forget some of the, you know, it is about just having fun and enjoying yourself, and not forgetting that you still can have that aspect along with the obviously cancer is serious, but it doesn't have to take over your entire world, if you like. And sometimes it's about remembering that and finding the things, and I suppose it's, if you're struggling with your sex drive, all those things then seem that much harder to, you know, to rediscover again, if you like. So you also talked about that you're talking to a lot more different people, and you've a lot more charities and healthcare professionals and stuff. Would you like to be doing a lot more of that to get the word out there about sexual health and sort of, you know, your own personal health?
Yeah, no, definitely. I mean, I just would love, you know, it to be on the curriculum of all medical schools and nurse training. You know, it's ridiculous. And oncology training and gynecologists and psychiatrists, because there are, you know, menstrual issues that impact upon your sex life, and, you know, they're often considered as, you know, mental health things, and they're actually not. You know, and you know, we work with all sorts, you know, gynecologists, dermatologists, you know, oncologists, you know, menopause clinics, cancer clinics. But actually it's only a really, really small group of people. And we almost feel like, people said to me, it feels like you're in a secret club. And it's weird, actually, when I often talk to people and they go, oh yeah, no, so-and-so mentioned you, and this person I've never heard of, but they're obviously, maybe they've had a brochure or they're recommending us. I'm going, right, okay, which is great, but this should be part and parcel of it. I've sat at conferences where a doctor's talked about sex and menopause, you know, and I'm thinking, oh, those are the lubes you're recommending, and really, I'm making a joke about it. I'm going, oh God, you know, I could have gone up there and started talking and giving you 10 minutes. I'd have done you a quick session. But things are changing. I spoke at Guy's Cancer Academy 2 years ago. It was the start of the pandemic, actually, just before it started, and that was great. Room of 50, you know, healthcare professionals, absolutely brilliant. And that was a start, and things are changing. It's starting to you know, they're starting to have these sorts, and having patient experts. This is so important, because we've got a few people have written for us on our website. The lovely Elvin Box, who's had prostate cancer. He's so vocal, you know. But we've had a few other people writing about their experience of breast cancer. People who've gone through. A young woman, you know, Lydia, who works for the Eva Peel, went through womb cancer. You know, it's your experience that matters, because I can talk till the cows come home about using lube, but it's about what you're experiencing. And I take so much from patient experts. You know, Liz O'Regan has just been amazing, but when she first started out, she was very wary about talking about her own sex life, and she'll admit this, because she didn't want to upset her husband, she didn't want to upset her parents, but actually she's so vocal, she's just brilliant. But this needs to be a conversation that every healthcare professional is comfortable having, you know, certainly if they're caring for people where the treatment or the condition has impacted upon sexual intimacy and pleasure and sexual function. You know, so yeah, it is, you know, and I love it. And I think maybe I probably have a bit more, I'm probably maybe a bit luckier because I've trained as a nurse. I'm confident talking about this. I've cared for people who've had these issues. Obviously, I have lots of conversations with people, happy to talk about my own experience. You know, but actually I've knocked on a lot of doors in the past and they've not been open. So now I don't, people just come to us, and it's quite nice, the pathways of the way people come to you and they go, oh, do you know sense? Oh yeah, you know, sort of you realise, or maybe it's the patient has actually mentioned your website and then they give you a call. But I would like a lot more people too. Because I feel like Joe Divine is a really safe place to actually send your patients. It's not a health website, it's a sex toy company that just happens to do this health side of it.
Hi, sorry, frozen again, sorry. So yeah, I mean, you obviously talked about Dr. Liz O'Riordan, which is great. You're obviously going to be involved in our Instagram Live at the start of our Wellbeing Week with Dr. Liz and Dr. Anise, which will be fabulous to have just really a general oversight of the, you know, the three topics in general. But you've obviously chatted with Dr. Liz before, and she's, as you said, become quite vocal about it. So I suppose it's just about as many people vocalizing these things and opening up the conversation and talking about it, and not being afraid to ask for help about stuff like that. I mean, you talked about your healthcare questionnaire or your little leaflet. Is that available on your website?
There's actually an article which is called the health brochure article, so it's got links, and there was a video on there, but that's, you have to sign into YouTube to go on it, but obviously people can call for it. You know, but I'm always happy to give advice on the phone, or they can email, or they can DM me on Instagram. I'm at Sam Talk Sex both on Twitter and Instagram, and we've got joe.divine on Instagram, or Joe Divine UK on Twitter. I do a lot of, people send me an awful lot of DMs through Instagram, and we do get emails, you know, pretty much most days we'll get an email about something. You know, and I would rather people call me or email me for more advice before buying something. Because often people, I don't want anybody to buy something that they're disappointed with, or it's really not suitable. So but yeah, but it is really important to have this conversation. You know, there's a fantastic person called Toril, she's got the Urban Kitchen, and she's had breast cancer 3 times, and she and I hopefully going to do an IG live. But you know, her 3rd time, she actually said to the consultant and talked about sex, and she said he went bright red. And her comment was, hang about, why are you not talking about this? You know, and I'm thinking, and she said, you know, I'm vocal and I'm loud, and I will actually say to, you know, doctors, hang about. But she said, what if you're a quiet, timid person thinking, well, actually, I really shouldn't mention that actually sex isn't great, or it's painful, or we just sex. And, you know, so that's why we do need patient advocates to actually challenge their healthcare professional. And I also say, I hadn't thought about it like that. I quite like hearing that when I see healthcare professionals. I hadn't thought about that. Oh, well, there we go. Made you think about it in a different way. And actually now you can phrase that question differently, or you can suggest something and you can feel comfortable that you've suggested a good thing, or, you know, you're not going to feel like, you know, oh God, I've spoken about sex and I've told them to go and buy a sex toy and they're really shocked.
Do you know, this has been really enlightening for me, as well as a patient who sometimes does get bogged down in the day-to-day things of living with a secondary breast cancer diagnosis. So a lot of the things that you've talked about today has been really insightful for me as well, and knowing that you can go to a safe space like your website, which is what's the website?
It's joedivine.com. You may find that you are blocked by your internet provider because they put automatic adult filters on. You can remove those, or you can ask for them to be removed. It is a safe website, but just to make people aware that, you know, people, and that frightens people off, and it's like, no, it's because we're an adult company, and all adult companies get blocked in that way. Even I think Yes Organic Lubricants occasionally get blocked as well, which is bonkers, but it's just
and it's worth having a look around the website, and as you say, if there's any questions or queries, if they reach out to you guys, you'll be happy to sort of talk them through or help them through whatever the first step should be for anything.
Yeah, I mean, if they type in the search as well, they'll often find that an article will pop
already
up,
something,
you know, and so actually there's loads of bits, probably too much information in some of them because they're really long, but quite a lot to take. But yeah, I would rather you call me. You know, I sound nice. You can hear that I'm passionate about what I'm doing, and I'm not going to make you feel embarrassed. And if I'm not around, and you know, if Paul answers, and it's a man answering, but he will take a message. But he's good at giving you advice about lubes, because obviously we use them and other stuff. But he advises quite a lot of men as well about the products. And you know, if it's our call service, then they will take a message, and I can call you. So like, oh, I can't do it, but I do know it takes a lot to pluck up that courage to make that phone call. You know, so it can be quite difficult for people. But even if you wanted to send for a health brochure, as I said, it's going to be updated. We've got lots of new products to go in there, which is exciting. But you know, there's loads of information on the website.
I mean, I think, to be honest, for the patients that I support through the charity, they're all very knowledgeable about lots of things, and actually they would quite welcome speaking to someone else who's then going to give them that same knowledge base back on a subject that's maybe not been talked about yet, or you know, and it just makes them feel more confident in having that conversation, and also that they're in the right place, because secondary breast cancer patients, we've kind of educated ourselves on a lot of things to do with all the side effects and the symptoms that we're having. So actually then to find someone else that's then going to help you with that said side effect is massive to a lot of them. So and
actually talk to you in a professional manner as well, not
absolutely. Just,
you know, I think, you know, treat you in a professional manner, because you are the people with the knowledge. I've learned so much from, you know, patient experts, and you know, sort of tips, and people tell me I've actually been using like that. Oh, I never thought about that. I'll pop it in an article. You know, it's like for me, it's a two-way conversation. It's actually we learn from each other. You know, and that's really important. I've learned so much. I've learned, you know, opened up my eyes to so many different things as well, and what people are going through, something that I might not have considered was really important, a tiny thing, but actually it's really important to somebody. So no, you're absolutely right. And I think it's been a massive thing, just knowing that these are the subjects that, you know, our patients want talked about. Sorry, I think we froze again. Sorry. The joys of technology. So I was really just going to round it off by saying our patients, this is one of the particular topics that has always requested. They're always looking for answers, and you know, there's lots of questions that surround it. So I think just in this chat that we've had today has answered quite a lot of the questions that I was given. So that's fantastic. Thank you so much. And I know you're going to be involved again, as I said, in our Wellbeing Week on the Instagram Live. So I'm quite sure there'll be more questions that pop up then. So what I'd just really like to say thank you for chatting with me today and sort of talking me through the various different things that we can do to help. And we'll get this all included as part of our Wellbeing Week subject that runs in February. So I look forward to doing that then with you as well. That's brilliant. Well, thank you so much. As I said, you're the first breast cancer charity that we've started working with, so it's great. It makes me feel really good. It's just so nice to be able to help more people, because this is really, really important. You know, sex is meant to be pleasurable and fun, and that's hopefully what we make it like.
Absolutely. And this chat in itself has been all of those things as well. So fantastic. Thank you so much.
You're welcome. All right.
So I'll stop the recording.